Mobile Community Health Workforce (MCHW), established in the year 2021 as a non-governmental organization, is committed to humanitarian activities and, most importantly, health awareness on open defecation, personal hygiene, environmental health and safety.
So the mobile community health workforce is all about awareness into our communities, and that includes personal hygiene, environmental health, and safety of our communities.
The program is about to cover how many communities or how many communities?
So this is a pilot program as a follow-up of another initiative of open defecation that we did last couple of years. I believe that was actually in 2021. So we did a open defecation program, and then this is also something that we are following up to see about the knowledge and also the skill that was obtained there, and to be able to really expand into other local government areas like Silame and then Sokoto South. But initially, the other program that we had was in Binji local government. For right now, we intend to have actually 3 local government that would be covered, and that means training the participants here that we have, up to 20 of them, and they will go out into the community. Each participant or trainee will train 10 household members. And so with that, we can have up to 200 trainees that have been impacted into the program of mobile health community workforce.
On 16 January 2024, MCHW, in collaboration with Rotary Club of Gig Harbor North, Washington State, USA, embarked on another project designed to promote personal hygiene, environmental health and safety in 3 local government areas of Sokoto State, Nigeria, namely Binji, Silame, and Sokoto South local government areas. At the opening ceremony of the training of the trainers, Abubakar Ahmad, the founder of MCHW, briefed the gathering on the previous project handled by the MCHW and Rotary Club of Gig Harbor North, Washington State, USA.
The regular meeting that we do came about discussion of open defecation. And so our members in the United States basically were wondered, because I told them, I said, okay, here in this part of the world, open defecation was being normalized in a way that maybe when you have your friend or your brother or someone, and all of a sudden that person would go in and say, excuse me, let me go ahead and open defecate, which means going out somewhere in the open field and just open defecate. So in that part of the country, in the US, they were very amazed. They were very surprised. They said, wow, imagine someone just open defecated right close to me. And so they were concerned that this is a health hazard, it's an environmental issue that needs to seriously be addressed. So Rotary Club of Gig Harbor decided that maybe we should do something about it. So, and again, if you look on the slides, we built sample toilets in Taudi, Binji. That was in 2022, in July, and to raise awareness. Again, I kind of described how it all started, keeping the environment clean, and just making sure that open defecation will not be a normal way of life, of living for us. And the reason why, because currently Nigeria is actually number one when it comes to open defecation globally. Actually, we do now pass India. India used to be number one, now we are. And that is based on a lot of resources. You can search on Google, you will see that Nigeria is ranked number one when it comes to open defecation, with an estimated of 48 million open defecate annually, or up to 15 million. And when you look at our population, that is more than 1/3 maybe. So that is a serious crisis. And because of that, again, they've decided that maybe we build toilets first. So I said, that's fine. Let's start with toilets. So we went to Saudi, we built a 4 toilets. And that was in, I believe, July of 2022. And also to raise the awareness about that. We built the toilets, right?
Some dignitaries who graced the occasion had this to say on the commitment of the founders of the project.
I'm highly honored to stand before you here this morning, representing my institutions, traditional institutions, in these very important public health initiatives. And like the chairman of the occasion rightly pointed out, if you can hear what he said, if I quote him right, it's like 90% of our diseases are as a result of the way we are handling our environment or surrounding. They are public health related diseases. So this occasion, I believe, is timely. And the choice of also participant and resource person also, I believe, is also equally timely. I must to commend the giant effort of this initiator and the founder of this initiative, and also the choice of the stakeholders here at the very platform. I must commend him for the job well done. And I assured him that we, on our part, traditional rulers, the support of traditional rulers in public health awareness campaign is catalyst. Working together with them will enhance ownership and sustainability, because most of the problem, it is not the intervention, but at the end of intervention, embracing ownership and sustainability of the land, key learning, what we learn from the professionals, we continue to. Most of the investment we are making today in the prevention of preventable diseases like poliomyelitis, other public health challenge, that I believe with the engagement of robust community stakeholders, sensitizing them properly, and I believe we will end all the preventable causes of public health diseases. So I believe I'm urging you, the participant, please interact fully. Pay full attention to what you will benefit from our wealthy, resourceful people we have today. And believe you are the people that are going to also reach the most critical component of society, that is the community. So mode of entry into community is something I believe part of the discussion today. So you need to also be more focused, more attention to what is here. To us traditional rulers, this is very, very important, very, very essential. When we have you at the community to change our attitude, because this entirely requires total behavior and attitudinal change, the way we are managing our environment. Even look at malaria. Malaria alone, if we can keep the sanitation everywhere, environment well clean, we will end up malaria. But today, if you go, no matter how the intervention by the government, by partners, you can see we are the people who are breeding mosquito. And we can eradicate malaria until we properly handle our environment. We fail to address this, then we will continue to have those challenges. And the issue of also other challenge, like poliomyelitis, the way we are handling orphan defecation. If I had, Nigeria is one of the leading producers of orphan defecation. Leading. This is bad. Nigeria is one of the giant countries in Africa. And then we are also rated backward. And if you go also by the index, you break it into the northern part, You will see also northern part will also host the most big component of this. If you go to Lagos, if you go to Port Harcourt, if you go to all those areas, you see maternal and infant mortality declining. If you also see our index in the north here, you see the Sokoto maternal mortality is unacceptable. So it's attribute of poor mismanagement of our environment. So I want to urge the participant, I want to urge you please to pay more attention, interact more, listen attentively, so that you can have a lot of takeaway for us. When you meet us, our community, you change our attitude, and I believe together with you and us, we'll end all the preventable issues. Thank you so much.
An NGO that organizes programs for health practitioners as TOT to go down to the downtrodden and train them in the areas of personal hygiene, environmental health, and the community safety. These three thematic areas are very important areas in the healthcare industry. Reason being, these are the cardinal principles of preventive health. And I'm pretty sure every one of us believe that prevention is by far better than cure. The gentleman who brought this idea and who sourced the fund for this important occasion has to be congratulated for bringing Sokoto to his people. The foundation has done quite a number of things. In the last 2 years, the foundation was involved in the construction of toilets for the downtrodden. This time around, it is bringing an education awareness for people to know what to do to prevent themselves from diseases. More than 90% of the diseases we suffer from in this part of the world are public health-oriented diseases. And with health education, we'll be able to prevent quite a number of them. I'm pretty sure that these activities will culminate in ameliorating the problems of health in our communities. I wish to congratulate every one of us that is here and pray that by the time you are done with the TOT, you'll go back to your communities and train those in the downtrodden that require this training for the upliftment of health and the provision of healthier society. We thank you most sincerely and pray that Allah the Almighty will see you through, and the program will be impactful to all of us and everyone that is going to benefit from this. We thank you most sincerely and pray that Allah will see you through this program. Thank you and God bless you.
What do you call it? Proved otherwise. For what people were suspecting of me at the time, I brought the Youth Exchange and Study Program to Sokoto State. I happen to be a full-time scholar at the Iowa State University of Science and University in the United States of America, and there was an event like this for Eastern scholars. And there came in one CEO of an NGO that is looking for foreigners to collaborate with. So when he saw me dressed in the native Nigerian attire, so he got attracted to me. His name is Robert Anderson, the former deputy governor of Iowa State. He has an NGO, Iowa Resource for International Service, that engages in exchange programs throughout the world, not only in Africa. So he got curious of me and he came close to me and he started asking questions. And that discussion was what led to the establishment of the Youth Exchange and Study Program in Sokoto State. At that time, His Excellency Abubakar Binji, the governor. In fact, when I brought the program, I went to the Ministry of Education, there was a lot of frustration. Because we have this apprehension and fear that anything having to do with the Western world will spoil our students, will spoil our children, will get them corrupted, will make them to leave Islam. I told them by what I saw, people there And the laws there in the United States don't protect children more than we do protect our own children. Now, if many of us here, after school, if you ask a father, why is your child? You will not tell where the child is. There, your child cannot go out unescorted. It has to be accompanied. So I told them what I saw there is quite different from what we are thinking. So in fact, the ministry could not allow me to get access to Governor Bafara at that time. We have to use some informal means through, I co-opted some people to assist me in the program, and one of them happened to be a lecturer to a relation of Governor Bafara at that time. So he was the one who shot us in to see Governor Bafara at that time. So he welcomed the idea. He even said he was nominating his own son, Babangida, what is his real name? Babangida, to go with the students so that the fear that there is something hidden motive behind the program will be moved from people. I received a lot of challenges. A lot of sermons were made at the Faithful Mosque by Sheikh Abubakar Binji. So many bad things, many bad prayers were made about the program. But unfortunately, these students went, the first batch went and came back, second batch went, and so many batches went. And up to today, there is no record that any of them has left Islam.
So this moment, I think, is a moment for me, not for you. All the participants, the invited guests, I think today is my day. We have all heard it from the professors, we have heard it from the chairman, we have heard it also from the district head. I think history is made, and I will not forget this day. I thank you all very much. I thank you all very much for attending this project, and I hope by the grace of Almighty Allah, it will bring the change of behavior of those at the community level, especially the household, 200 people who have been identified as the household. I will just say thank you very much, and may all God bless all of us here. Thank you.
The sponsors of this program should be very, very glad that you have taken this very, very good assignment, this very, very good gesture. And I'm so happy I've seen a lot of ladies. Kudos to the ladies, welcome. Because whenever I speak, whenever I go to a gathering, I make sure that I see ladies, and I'm so happy.
The training, which lasted for about 5 days, was attended by 29 participants, representatives of benefiting communities, resource persons, as well as delegates from the State Ministry of Health, among others. During the training, some resource persons interviewed expressed their satisfaction with the performance of the trainees and described the project as a welcome development.
A registered dental therapist, a retiree from Usman Danfodio University, Sokoto, presently engaged in private school. I lecture Gamji College of Health Technology, community health officers on oral health, and I equally take the same thing with Gamji School of Nursing, Sokoto, which is just recently established. The role here is to assist the community to be aware of their duties to maintain their own personal hygiene, particularly oral health. Oral hygiene, like I did explain inside, is actually a mode or a way through which you keep the mouth clean, because whatever you take passes through the mouth, and if the mouth is unhealthy, whatever you take is equally unhealthy. And we try to educate them, to enlighten them the relationship of the mouth itself to the general health.
Okay, today's program is all about continuation of yesterday's training that is channeled towards educating the communities in Sokoto State, precisely in the 3 local governments comprising Binji, Silame, and Sokoto South, on 3 thematic areas, which are environmental hygiene, community safety, and personal hygiene skills. So, thank you very much for that question. So what I will say, as an educationist, I was taught to believe that human beings are not empty-headed. So all of them quite well have something handy, so to say. But this program, I believe, have done so much so far to have changed their mindset towards the impact and the consequences of so many health attitudes and actions that are detrimental to health, especially in the area of environmental and personal hygiene.
And my role is actually as a facilitator. Yeah, because yesterday I was able to deliver some lectures, although it was very brief due to limited amount of time. But facilitator is one of my role, and also kind of supervising the whole program. As you can see, I have been going around taking lists of people and also having them to write their data, like residential address and some mobile numbers like that. So basically, I'm coordinating the whole thing in some aspects. To my understanding, the usefulness of this program is very, very important, and I can even say is vital. Personal hygiene, environmental hygiene, and safety skills are very crucial to the development of any human existence. So the usefulness actually is related to our health, okay? And it determines our survival rate. So you can see the usefulness cannot be overemphasized.
That is a very good question. Overall, a significant number of or percentage of the illnesses we suffer today in our communities are usually from our personal hygiene, environmental hygiene, and how we take care of ourselves. So that is why we find it necessary to educate the community on the importance of personal hygiene, their environmental hygiene, and its impact on their overall health and well-being. So now, on personal hygiene, it has to do with how we take care of yourself. Oral hygiene, it includes oral hygiene, your hair hygiene, nail hygiene, your toilet hygiene. What you eat plays a significant role. How you take care of your hands before and after eating, and how you interact well with your surroundings. Wash your hands regularly to prevent a number of communicable diseases that you can pick from some substances into yourself. And
in terms of community health, mobile community health workshop program that we have. Today it talks about a lot more into the identification of problems, into the personal hygiene, environmental and safety. So we delve into discussion on different problems concerning our communities, and then we also delve into some of the solutions. Some of the solutions relating to the problems that we have for community and personal hygiene. And I'm really excited as we are going through the curriculum of FAST program or FAST model that we use, PHAST. This FAST model is an evidence-based personal hygiene program or methodology that we feel is really important because it's personalized, it's individualized to the needs of our community. So I'm really excited. I can't wait to continue interacting with the participants, and I cannot wait to see the end of it today and also the beginning of tomorrow's episode or maybe program. If I was to rate their level, maybe 1 being the lowest and 10 being the highest, I will probably rate their level of comprehension to 8. And the reason why I said that, because you know, with the model or the curriculum, there's always this pre-assessment that we use and then post-assessment. So when we go through each segment of the module, when we go through that, and then we will see for the post-assessment, we ask several questions, open-ended and closed-ended questions. And then we can determine whether they understand or not. And I think they do understand, because we ask them like questions of, can they rate their understanding? Yes, they rate it. We ask them questions of, give us examples of some of the community health hazards that are concerning their communities. They give us, and then we ask them questions about, did they understand some of the needs process that we can use into the community to actually impact the members of the household. And they've actually mentioned some of those examples and even how they can be involved into their community in tackling all these issues of environmental health crisis that we have in the Binji, Silame, and then Sokoto South.
The aspect of training that I took is assessment and evaluation of the trainers, right, of the participants. That's to see the knowledge they have gained from the training they have undergone from beginning till today. So that was what I used. I teach them different modalities, and I use certain modalities that can be able to make me understand they have really gained the knowledge they have trained. And they have understood all the training we have given them from beginning to today. This understanding the kind of community we are living in, we all know, even in Africa, we are in Nigeria. In Nigeria, we are in the northern part of Nigeria. And even in the northern part of Nigeria, we are from the northwest, which is predominantly Hausa that are culturally identified. And the selected local government areas are really the most needy local government areas that have been identified. This project is very, very important and very valuable, and it is going to make a great impact. If we can take a practical example and go and visit these villages that have been selected where the program is going to be implemented, you will not understand that up till present moment, many of them doesn't even use toothbrush. So by the knowledge that the participants gain, they are now going to teach them on how to take care of their teeth, to provide oral hygiene, and how they are going to give environmental health, how they are going to keep their environment healthy. And at the same time, all the safety measures that need to be taken care of, they are being taught about those safety measures they need to consider.
This project is very, very useful and is very timely because it is to create awareness on change of behavior for the people related to health education. There are issues discussed on personal hygiene, environmental hygiene, safety, and also dental hygiene. It is a 5-day project which we call TOT, Training of the Trainers, held here in Sokoto Guest Inn in Sokoto State. And 3 local governments are selected, Binji, Silame, and also Sokoto South local government. The project is sponsored by Rotary Club of Chicago in the United States of America. I feel very delighted and very happy to participate fully in this project. And I want to say that this is the second project he is bringing. The first one was also in Binji local government, which has to do with the menace of open defecation. We are also looking for the third project to come probably in February 2025. Benefiting communities, I will advise them to ensure that there is sustainability on all these programs we are implementing. And we have appointed supervisors who will be visiting these communities and village levels to ensure that there is sustainability of these programs. We have also distributed health kits to them for use in personal hygiene and also in safety, keeping the environments clean.
And I am the secretary to this wonderful project. The role I played is, I should call it multi-purpose role, because anything that has to do with the secretariat, starting from printing or designing of templates, recording the interested participants, you understand, anything that has to do also with the logistics for this wonderful project to be successful.
At the last day, 20 out of the 29 participants were selected and posted to different communities for awareness on environmental health, personal hygiene, and safety, which is the main reason of the project.
This program has brought us the way how we treat ourselves to prevent ourselves from illness like diarrhea, like how to treat our oral treat, and how to find ourselves in a clean environment.
All right, thank you very much. Let me start first by congratulating everyone that's here and then appreciating the effort of the organizers. So far so good. The program has been beneficial from the introductory aspect we have seen, and from the laying of programs that are supposed to take place. I am very hopeful that this program is going to be of beneficial to us. So far the introductory aspect we have heard about the program and our expectation. So I'm very confident that this program is going to be beneficial to us, the participants, as well as the community at large.
This is one of the events I've seen in this community. It will be very important and useful to the society of Sokoto State, because if you just see maybe, or if you go to some areas, you see they have open toilets, they are just defecating anyhow, or if you go to some farms. So this will help to bring to reduce to the minimum the kind of communicable diseases that are going around the society, and also it will bring hygiene. You know, most of the diseases, or most of the communicable diseases we are having, they are like originated from this kind of defecation. Some of the defecation will wash away and go to the rivers, and some will pick from the hands. And for sure, inshallah ta'ala, we are praying that people will give maximum cooperation, and we pray to have maximum benefits.
The lectures to me were useful. They taught me how to improve my hygiene as a person, and how to tell others the importance of hygiene to them and into their environment. From what I got, I learned how the manner of approach, how I'll approach them. Since these people I'm going to meet, they've never seen me before, they don't know me, they don't know where I come from. So by the time I go there, I have to create a good relationship between them, show them that what I come with is of benefit to them and not of a bad or of negative effects to them. It is going to improve them, not only them, but the society as a whole. And the program is very useful, especially here in Nigeria, that we practice less hygiene. So bringing this program into the rural society will actually improve their knowledge.
gaskiya kungiya wanga shiri ta zo da shi to abina mai muhimmanci saboda ban mantawa shekara ta 2014 an taɓa wannan tsari kuma aka zaɓi mazaɓata ga lokacin na hakimi to an tsaftace muhalli ga wannan lokaci kuma ga lokacin curutoci ɗin da suka taso Allah ya sa aka samu sauƙi sanadiyyar waga tsaftace muhalli saboda haka wanga shiri da suka taho da shi to abina mai muhimmanci gare mu kuma abina wanda muka murna kuma abina wanda muka jin daɗi na.
The awareness lasted for 3 weeks and covered many communities under 3 selected local government areas. Paying visits to community leaders before proceeding to door-to-door awareness is part of the guiding principles of the project. All the community leaders visited appreciated the effort and thanked the initiators for their foresight.
And the entire membership of the community, I wish to welcome you here to my palace to also assure you of our total commitment toward eradication all form of mismanaging of environment, issue of refuse dumping, issue of waste management, issue of what do you call it, often defecation around the community, and the issue of sewage. The way we are handling sewage, it is very alarming that we need to take action. And then any organization like yours coming with these very beautiful initiatives aim at mobilizing peoples to change their total behavior, the way they are handling often defecation is very alarming.
And some of the beneficiaries of the project from various communities applauded the founders and promised to make use of what they learned during the awareness campaign.
Wannan shiri ina maraba da shi, ina murna saboda na ga shawata sosai. Allah Ubangiji shi sa a wayan wannan shiri lafiya.
Gaskiya ni na ga abin mai muhimmanci na sosai, an taimaka mana ne saboda kariyar lafiyar mu da yaran mu.
Shi kuma abin an ka sa ga asawaki ba sai a matsa haka sai a sa haƙura a wanka ba da ƙarfi ba.
Irin kariyar muhalli da kashi na yara, za ga yaro ga rariya ya zo yana kashi ko kuma ana zuba shara ga rariya, da kuma irin gida za ka same shi kama mutum 10 ana amfani da toilet ɗaya. To kaga wayar da kai da kuma irin idan za a ci abinci a dan wanke hannu kamar so 5, 6, 10 da sauransu, duk yana kawo, kamar yadda kuka yi bayani, yana kawo kariya daga cututtuka.
Ƙaru ƙwarai, wallahi mun ƙaru sosai, mun ƙaru, mun kuma gode Allah shi biya. To abin da mun ka ƙaru da shi gashi ko na wanke hannun ga ko shi ba wasa na ba.
Gaskiya dai na ji daɗin wanga al'amari kuma na ji daɗin tahowar ku. Saboda dai tahowar ku na ƙara ƙarfafa mu ƙara abin ga tsaftace muhallin mu ko ina da bayi da cikin gida da waje. Don haka mun gode da tawaku kuma mun ji daɗi kuma Allah saka muku da alheri.
Ka ƙara mai da inda aka ɗebo dauɗa a koma canza guda a koma sawa a gwalgwalo da ke da yara kowane lokaci ka a ce kuma a samu a yi insha Allah. A wannan kuma mun ka baki shi
mun gode ƙwarai. Allah ya kyauta.
Allah ya sa mu dace.
To amin.
Allah ya taimaka kuma za mu ƙara dawowa mu gani ya abin da mun ka yi an fahimta an gane tsafta ana yi kuma za mu sake da insha Allah mu kawo wani abu insha gidan guda nawa?
Barakallah masha Allah.
Ya haji koki a sa muku albarka. Wai da diyan da jikokin da tattaba sun ne da
nan duk jikoki na.
A ba mu shi mutum guda. Na Allah. Ita ma za ta yi karatu ta ina. Ki koma wurin waina. Sassanninku mun zo ne daga wata ma'aikata da ta kula da lafiya. Kun ga abubuwan da muke gudu. Ga tsintsiya. Kowa dai ya san aikin tsintsiya, ya kuma san aikin albashi. Sai a rika shara ana tsaftace muhalli. Saboda yara gare ku, in sun ka tattaka kuma za a iya ji musu. Ga kuma takalma na sawa. Duk ba mai takalma.
Ja na kai.
Da akwai kusa.
Ja.
Ya gode ba. Shi annabi ma ya. Amma zamani da ya taho sai su wani zai ci aikin biyu da ya yi ma'aikatan wanga kan su ba kan goge ba ko shi a hankali ko ina goge da jini na ga kuma sabu in yi ka tsoho sun yaro ya ce ci akwai yanayi da za a bashi da wani a murza nan ma baya duka cikin cuta nan ma ki murza nan ma akwai yanayi da murza nan ma a murza nan cikin akwai da na akwai ba akwai abin kwalkwala kwani duk su tsaya nan akwai abin da kisan cutar nan daban cutar kuma nan daban wani za ki ji ya ce bai ji ga kunnen dama akwai abin da ya sa kin rake duk wani cuta kuma ki ba nan wanda kuma ne shi daban da yaro kuma ki sa